Welcome to Cutting Edge Pain Relief. And in this video today, we're going to talk about diabetes and pain relief, specifically diabetic peripheral neuropathy. And I know many times we'll have a guest visitor to come in and speak about their area of expertise and give us insight in terms of how they've been able to help patients and really what has been instrumental in them bringing new breakthroughs to both patients as well as to the market. However, this particular topic, we've decided to pick because it's personal to me. So one of the reasons why I became a doctor is because of what happened to my father. And my dad was a battalion fire chief who was a really strong, good guy, like many firefighters are. And after he retired, he had a stroke. And in having that stroke, his diabetes really got out of hand more so than what we had expected. So much so that it came to the point where at one point in time, from a clinical standpoint, we were looking at his foot and we had a surgeon say that he needed to have an amputation. And that ended up tending not to actually occur because of some good care that he got from my mother that was able to really resuscitate that foot. But at the end of the day, diabetes and the pain that's associated with it affects people with such significance that we really sometimes don't talk about it and give it its due justice. So on this particular discussion, one of the things that we're going to get into is the impact of diabetes, how it affects you, particularly from a standpoint, how to figure that out, and then also what are some treatment options out there that make sense. This is one of our talks that really focuses on the research, papers, and helps explain fancy basic science papers so that the layperson, the people that really are vested in this, can understand what are some of the cutting edge techniques that are out there so you can basically truly punch pain in the face and get back to leading the life that you deserve. So we've picked out a number of scholarly papers that have been published in journals, and we're going to kind of click on different highlights to give you insight and guide you through the context of diabetic peripheral neuropathy. What are some of the downsides? What are the ways to really be able to get further understanding, and what can you do about it? So one of the papers that we're going to take a look at just right off the bat is the aspect of the healthcare cost of diabetic peripheral neuropathy in the United States. So when we take a look at this, it actually gives us some understanding about the following: is diabetes as a whole doesn't always result in diabetic peripheral neuropathy, but it can. And that neuropathy can sometimes result into a foot ulcer that becomes fairly complicated. Sometimes it can have cellulitis, which is an infection of the skin, or sometimes it can be osteomyelitis, where it's an infection of the bone. Either way, many of these things can result in lower limb amputation or potentially the possibility of lower limb amputation, which, as I'm sure many of our viewers can be able to attest to or have concerns or worries about, can be completely devastating to one's psyche. So we're going to kind of get into this paper just a little bit, not into a lot of depth, but one of the things that we see is that as a whole, in terms of all diabetics, there's somewhere around, give or take, about 11 million diabetics that are out there. Of those, about 5 million, almost half, have diabetic peripheral neuropathy. So when we explain what exactly is diabetic peripheral neuropathy, in essence, it's a nerve problem that is somewhat related to diabetes. Originally, it was surmised that it was because it had to do with more of a vascular cause, meaning there was a blood vessel issue where blood was not being delivered. But at the end of the day, we've kind of come to think that maybe there might be more plausible reasons for why diabetes causes a problem with the nerves. So in this paper, we talk about diabetic neuropathy and the sensory neuron and new aspects of pathogenesis and their treatment implications. So what does that really mean in English? What that really means in English is, how does diabetes affect the nerves to let you understand what it is that you feel, and exactly how does that happen? Okay. So when we take a look at that, one of the things that it says is diabetic. I'm going to explain this for you, okay? But it says diabetic polyneuropathy continues to be considered a microvascular complication, particularly associated with nephropathy and retinopathy. So what does that mean in English? What it means is that there is an issue that we believe there's a blood vessel problem, and that blood vessel problem not only causes a problem with the nerves, but it can also cause a problem with the kidneys and other organs that are dependent upon blood flow, like the eyes. So retinopathy is referencing that aspect of the retina. When we go on, it says the microvascular hypothesis, however, might be tempered by the concept that diabetes directly targets dorsal root ganglion sensory neurons. So I know that's a mouthful, but again, like I said, we are going to explain this. So the dorsal root ganglion nerves are a special nerve or collection of nerves that sit within the context of the spinal cord. So to give you a frame of reference, because sometimes a picture is worth 1,000 words, if we were to take a look at a model like this, right, what we can see is that there's an exiting nerve root, right? And that exiting nerve root might be right around here. That's a little thing that I just kind of had a little flick of. That's what we're dealing with when we're talking about that exiting nerve root, right? Well, as we get into that context of the nerve root, inside deeper in there is an area that exists. It's called the dorsal root ganglion. So let's show you that with a little bit better clarity with a bigger model so that you can understand what that dorsal root ganglion is. So if we were to take this model, a little bit more prominent in size, and we turned it so that you could see, if you can be able to pick out the areas of this bulge right here, this is where we surmise the dorsal root ganglion is. So in each one of those areas of that nerve root, it shows a bulge that's there, and it's a collection of nerves that act as, if you would, a nervous system, kind of a central communication system, the same way as you'd have like an EMS that would direct traffic or ambulances or things along those lines. It's the same thing with what you have with the aspect of a dorsal root ganglion. And so those dorsal root ganglia can basically be influenced by different things that take place. And in this picture, you may not be able to see it quite as well. But one of the things that happens is that nerve root that comes from the spinal cord, it basically has a sensory component. And originally what we thought was, if that blood vessel, represented by this circle over here, gets smaller in nature, then it can cause problems to the nerve. And it can make that nerve not function quite as well. It can make it smaller in comparison. It can cause even breakages of those nerves and how they communicate. Well, as we start to take a look at dorsal root ganglia, what we really believe is that that collection of nerve may not just be only related to it being vasculature, but it may have other causes that downstream end up causing more sensory problems, more pain problems, and we have to kind of figure out how we can be able to make those things better. So one of the other papers that we looked at is an update on the diagnosis and treatment of diabetic, somatic, and autonomic neuropathy. So again, what does that mean in English? What it means is basically us looking at the different types of how the nervous system is affected and what are some different treatment options for it, as well as how can we figure out what are some of the causes. So within that paper, we see the following. We see that there's different types of fibers: large fiber, large and small fiber. And the fiber that we're referencing are nerve fibers. So this is the way that we're going to figure out, how can we tell what is diabetic peripheral neuropathy? How can you figure it out? How do you know if you have a nerve problem or not? Well, one of the ways is something that's called a nerve conduction study. So what does a nerve conduction study really mean? It's something that's called an EMG most of the time, which is electromyography, where the neurologist, physiatrist, or other doctor places needles within that area that is the area of question. And then you conduct an electrical sensation and you measure that electrical sensation across the nerve that was the nerve you're trying to figure out. Many times, that nerve, if it's injured, will conduct slowly, meaning that signal that you measured at one point, it doesn't match what standard numbers are. Nerve conduction is, in essence, that same area that is sensitive and is specific. However, sometimes that large fiber is not always indicative of pain fiber, so sometimes we have to go smaller. So that's when we start looking at things like disability scores or possibly skin biopsy, which sounds really involved, but the skin biopsy for small fiber nerve is actually not as aggressive as what you might think. It's a small punch biopsy that allows you to get the skin and then select, are those nerves a potential problem and issue? So this looks at a number of different treatments that are pretty common for small fiber nerve issues, and specifically diabetic peripheral neuropathy. So what are some of those things? Are going to be medicines that you've heard multiple times. But what we're going to do is to give you a different spin on some of these medicines. These are what are traditional medicines. We're going to talk to you about is what are treatments that aren't so traditional that may be able to give us a better result. So the first on the list is something that's called pregabalin, also another name for Lyrica, that has a different procedure, or rather, pardon me, a different profile that's based off of being an anticonvulsant, but it's meant to try to decrease that nerve pain. The second is gabapentin or Neurontin. The third is duloxetine or Cymbalta. The next ones after that are antidepressants like amitriptyline and phenloxifene, both of which have abilities to be able to provide some degree of pain relief. And then you start getting into traditional pain medicines like tramadol and tapentadol, also known as Nucynta, or topical treatments that are over-the-counter capsaicin, lidocaine, and isosorbide dinitrate. So those treatments have been the mainstay for years. But what if we could talk to you about other treatments that may have better efficacy and decreased side effects? Would those be some things that you'd be interested in? So let's talk a little bit about that. So this is going to seem a little bit like overkill, but hear me out for a second. The severity of neuropathy is associated with long-term spinal cord stimulation outcome and painful diabetic peripheral neuropathy, 5-year follow-up of a prospective 2-center trial. So in essence, this is a research study that looked at spinal cord stimulation and whether it could help patients that had that nerve and foot pain. Do we automatically have to go to spinal cord stimulation? Of course not. But there's sometimes where patients have had this for extended period of time, and they're trying to figure out how can we be able to decrease this if our medicines aren't working or those medicines have side effects that are associated with it. We talk about diabetic peripheral neuropathy as it's just a secondary problem and issue. And for many people, it's not. It's a pretty debilitating problem that prevents them from being able to do the things that they really want to be able to do. So the study itself looked at a small number of patients, about 48, and it was a prospective multi-center trial. So what that means is they basically signed patients up and they went to different centers and they had tests that were evaluated going forward. So the treatment success was observed in about 55% of patients after 5 years. So a little bit more than half of patients got better, and that stayed that way for at least 5 years. And we talk about spinal cord stimulation, it may not be our initial treatment option, but it may be one of the options for us to look at for potential relief, particularly when we're looking for a long-term treatment option. So this table shows a numeric rating scale, which is like a pain score, and what happens after a period of time. And depending on the person, whether it's day or night, they're able to take that pain at somewhere around a 6.7, almost close to a 7. And depending on that time frame, whether it's 3 years or whether it's 5 years, be able to decrease it to a 4 to almost a 4.3 with consistency and see that you could be able to provide pain relief. So when we take a look at being able to understand how do these things stack up, it gives us some further insight about, should we consider spinal cord stimulation? Well, maybe we have some other options in lieu of that that aren't traditional, but also make sense. So this looked at topical treatments for neuropathic pain. And although it's a bit dated in terms of it's 2018, so almost 3 years or so ago, it does have relevancy. So what they did is they took, again, another look at how does the problem actually occur. So you have this increase in sugar. That's what hyperglycemia means, because you have an increase in glucose because of your diabetes, and it causes a number of different things. It can decrease the amount of oxygen that goes to the areas of the nerve. It can cause that decrease in oxygen can cause inflammation, in essence, what sometimes is called an inflammatory cascade. And that inflammation can then cause a problem with the nerve. And that nerve damage occurs potentially or primarily to sensory fibers of the nerve that then has influences on a number of different types of channels that are expressed in the nerve that allows for that nerve to function, which then results in you having changes in what comes out of the nerve and how frequently that nerve fires, which is in essence the fancy biological way of saying that patient has a problem with their nerves from diabetes, i.e., diabetic neuropathic pain. So the next picture is a little involved, and although you may not be able to see it all that well, it shows all these different moving molecules and thumbtacks and things that are basically channels that connect into the areas of the nervous system from one spinal nerve to another in terms of how that signaling process goes about. And what it looks at is what are the different treatments that really might be able to provide value. Is it capsaicin? Is it clonidine? Is it ketamine? Is it lidocaine? Is it amitriptyline? Is it none of the above, right? So what we want to know is how can we be able to understand what's going to be one of our better treatment options? So that paper then breaks it down as follows. It basically references the aspect of capsaicin cream, capsaicin gel, and most importantly, an 8% capsaicin patch. And what they saw is with the others, it sometimes didn't last as long as what we wanted. It may give you to about a month, but not necessarily significantly longer than that. Versus a capsaicin patch, which has been shown to provide not only improvement in sleep quality and being able to tolerate it, it also improved pain frequently out to about a year or so with good relief. Another element of that is being able to identify, besides these two problems and issues, what else might be able to prevent patients from getting good relief. And when we take a look at those options, one of the things that comes up is the following. So an 8% capsaicin patch in treatment of peripheral neuropathic pain. It was actually looked at last year at Pain Physician Journal, which has a number of different evaluative pieces. And those things include that they took a look at 120 patients, and they were able to see that about 30% had a decrease in their overall pain. And although it's for a short period of time, which is somewhere within the context of 12 weeks, there's only one out of those patients that really had a problem or issue. So as we've been able to kind of figure out, capsaicin may be a really effective treatment option for pain relief that can provide benefit. Okay, so one of the questions that came up is the following. Is one patch for a month? Not necessarily. So in regards to how you actually utilize that patch, as we actually talked about in a different video, which is on our YouTube channel, it actually can be able to last you sometimes as long as 3 months and occasionally a little bit longer than that. It is FDA approved. It is indicated for DPN utilization, but it's also used for some other treatment options, including shingles. But there is an interesting component of this because for us, as a understanding of what's happening with diabetic peripheral neuropathy, the basis of it, one of the things that we've decided to do is to have a potential research study and be part of a research study with a multi-centered group that looks at post-surgical nerve pain and whether that nerve pain can be dulled or possibly even stopped by a patch such as this. We are actively seeking enrollment of patients, and we're starting that come May for people who might have pain from you had a knee replacement, cardiac surgery, thoracic surgery, potentially changes from the hip, anything where you've had an incision and you have resulting pain that's present because of that surgery, whether it's hernia or other things along those lines, you may be a potential candidate. So if you're interested, by all means, please let us know. And one of the best ways to do that is to potentially be able to sign up for our newsletter, and that newsletter will allow for you to be able to reach out to us, contact us, and give us information about you and whether you have interest in certain topics and what could be helpful in order to be able to make you get connected for further pain relief. One of the last resources that we wanted to provide to patients that have peripheral neuropathy is the following. And that is, there's a Facebook group that's called Peripheral Neuropathy Success Stories. And it allows patients that have been able to beat this problem and issue and feel better and have better quality of life to have resources and connections with other individuals so they can learn how to be able to punch pain in the face and get back to leading the life that they deserve. So although I know this topic had a lot of in-depth elements of fancy research and things along those lines, the take-home points are the following. Is number one, diabetes affects a number of people in this country, quite a few, and neuropathy affects nearly half of diabetics that exist. What probably is a little unknown fact is not all the time does that neuropathy initially rear its head as a painful condition. Sometimes it's a little bit more nondescript, meaning you may have some decrease in sensation, you may have some numbness and some tingling, but it doesn't always show an immediate benefit. I think one of the questions that came up is, would steroids potentially help, right? Well, it depends on the person. And the thing is that what we'd have to be cognizant of is even because we're injecting it within the area of that's the targeted area, is sometimes that steroid can have systemic effects, meaning it can spread. And when that steroid spreads, it can cause you to have an increase in your sugar because you're diabetic. And so that increase in sugar can sometimes cause some other things to kind of get out of whack. So in going to the context of talking about how can diabetes and the number of people and being 50%, one of the things that we want to do is be diligent with trying to see, is this truly diabetic neuropathy, either through nerve conduction studies or through potentially doing a scan punch biopsy, or finding another way to be able to evaluate it by your physician at hand to see if that person, be it he or she, can figure out whether they believe you're diabetic, whether they think your neuropathy is diabetic related or not. Diabetic peripheral neuropathy is not always worsened because you have a hemoglobin A1C that's within limits. Sometimes you could have a perfect glucose control and then have other problems that resulted in this. Additionally, you also can have horrible glucose control, and sometimes the diabetic peripheral neuropathy is abated or lessened and not really a problem per se. The other things that we'd say is if we're looking at different treatment options, you can try pills, and pills may give you some relief, possibly things like the anticonvulsants that we talked about before, maybe some over-the-counter topicals, possibly certain specific type of traditional opioid pain medications. But one of the things that's really starting to come more into current thought process and vogue is, can we use topical treatment options to give us a good response with less side effects and more prolonged sustainability? And so that capsaicin patch that was mentioned before, that was the 8%, is one that is probably one of the first line therapies and thoughts to be able to utilize in order to be able to try to improve overall pain. In addition, the other thing to consider would be, is spinal cord stimulation a potential factor for relief? So can we target that nerve at that dorsal root ganglia area and region and give a much better response than what we otherwise could before? And finally, you don't have to do it alone. That if you understand that there are other people out there who are facing a similar problem with nerves in the periphery, and that you have that burning sensation, that tingling sensation, that sensation that just is just overwhelming, that there are other people who are out there and you can be able to lean on their shoulder to be able to help. Hopefully this is helpful in terms of understanding some kind of esoteric topic, breaking down what are some of the treatments as to why it also occurs and how many people it potentially affects. And if you enjoyed this video and you're watching this at a later point in time on our YouTube channel, please like, share, and subscribe so that other people can be able to learn how to punch pain in the face and get back to leading the life that they deserve. One of the questions that came through was, will this help all neuropathy not caused by diabetes? I think there's some universalities between looking at different treatment options that don't just exist for diabetic neuropathy alone. But in this particular context, there's indications for insurance that certain treatments will be able to be utilized for diabetes and some won't. One of the hidden things that I didn't mention about spinal cord stimulation and why it might be of value is it can frequently increase the size of the vascular lumens. What it, in essence, in regular English, that means that you can get more blood flow to that area in that region, which sometimes can be healing in nature. Thank you for those of you who joined us currently, and for those of you who will join us later and see this in recording. Please hit like and subscribe and let us know what are some of the other topics you'd like to know more of. Thank you so much and have a great day.